Aravind KRISHNA. Yeah, please come up on stage. He will be talking about recurrent retinoblastoma. Oh.
Good morning, everyone. Good morning, judges. So today, I'm here to talk about a case where there was an unusual recurrence of a tumor whose story we thought was over. So sometimes we all try to forget our past, but our past may not always forget us. So this case is titled Echoes from the Past. So the tumor in question is retinoblastoma, which you all know is the most common pediatric ocular malignancy. It is triggered by mutations in the RB1 gene. It can either be familial or the much more common sporadic one. So most commonly, it can present as leukocoria or strabismus, and other less common symptoms are red eyes, poor vision, heterochromia, hyphema, and it can also be asymptomatic. So retinoblastoma is usually a clinical diagnosis, and ocular imaging such as B scan or MRI can also help, and it is a multimodal treatment approach, and genetic screening is also very, very important. So we talked about retinoblastoma. So coming to our case, so this was a 20-year-old female who's a known case of bilateral retinoblastoma. So she was diagnosed as a child back in 2005. So CT scan done in 2005 was suggestive of bilateral retinoblastoma with optic nerve head infiltration. Bone marrow aspiration and lumbar puncture done at that time was negative. So subsequently, the patient underwent 9 cycles of chemotherapy, the last cycle on 18th of April 2006. Following the treatment, the tumor had successfully regressed, and the patient had been prescribed low vision devices and was on regular follow-up. So the patient from 2005 until now was symptom free, as in there was no new symptoms. So the patient's vision as on 31st May of 2024 was 660 in both eyes. So now what happens? She comes to us on the 25th of November 2024, which is 20 years from the point of diagnosis. She came with complaints of defective vision in the right eye for the past 6 weeks. And as you can see, the vision in the right eye dropped from 6/60 to half/60. On evaluation of the fundus, we saw that there was a reactivation of the retinoblastoma at the edge of the prior calcified lesion, as you can see on the image. A diagnosis of a recurrence of retinoblastoma in the right eye after 20 years was made. So the patient was then managed with transpupillary thermotherapy and intravitreal topotecan, followed by systemic chemotherapy with the vincristine etoposide carboplatin regimen. And thankfully, the patient's vision improved to 5/60, and the patient is now on regular, more constant follow-up. So what is unique of my case is that usually a recurrence in retinoblastoma can occur within 2 to 3 years after treatment completion. That is a common story in many patients. But this patient had a recurrence after 20 years. Such a late recurrence of this tumor has rarely ever been reported. So what are the clinical implications? Bilateral or heritable retinoblastomas, especially with those with RB1 mutations, can have recurrence at any point in life. And hence, a continuous follow-up is very, very important in these cases. And there's also a probability and a high risk for secondary malignancies in these patients, such as osteosarcoma, ravings, and you should always be on the watch out for those. So the final take-home is that a long-term follow-up is needed for retinoblastoma cases with RB1 germline mutations, and early diagnosis and management can have a favorable prognosis. I would like to thank Dr. Usha Kim for giving me this case.
I have to ask a question.
Yes.
What has been the reason for low vision in this child for so many years, and what was the reason for sudden drop of vision?
Sir, the low vision was probably due to the tumor and the subsequent chemotherapy, the residual damage which the tumor left following its.
Was maculopathy?
Yes, sir, there was.
Neuropathy, what was there?
There was a maculopathy.
Or amblyopia or what?
It could be attributed to amblyopia. So there was the residual scarred lesion in the
month of May when the child came with
yes,
560 or 660 vision.
Yes, sir.
That time thorough examination was done. Everything was done.
Thorough
OCTs,
examination.
OCTs, etc., etc.
Yes, sir.
Or it was just a clinical checkup?
It was both a clinical and B scan and imaging was done.
Was there a change from that to the next presentation when she came with the half 6/60 vision?
Yes, sir. On the presentation on May, there was a calcified lesion which suggestive of the old retinoblastoma. The image which I've not yet put here. But in November, the image showed a reactivation of the tumor in the prior calcified region. So in May, there was no new lesion. There was just a scarred
Changes on
lesion.
ultrasonography?
The
Scan change?
yes, the scan showed the tumor, the new tumor from the prior edges.
Now, how this tumor affected the vision? That is what I'm asking. The reactivation affected the vision.
It probably would have encroached more on the macular area, sir, and causes decrease in vision.
Actually, what sir is trying to say is that the lesion, what we could see, was not affecting the macula. It was just lying inferior to the macula.
Okay,
so
sir.
possibly he was expecting a better vision from that patient. That's what I'm getting.
That's what I'm saying. But is initially why the vision is so poor,
Yeah, sure.
and then drop in the vision, because follow-up means follow-up. She has been
Yes.
regularly following, means we okay anyhow.
Okay. One question, like why
Yes.
was intravitreal given?
Intravitreal topotecan was
Yeah, why
given.
was it given? I could not see any obvious seeds per se. So is it a routine thing which is done in your setup?
Yes, sir. In our when I spoke to the retina consultants, they told me the routine focal therapy of transpupillary thermotherapy with intravitreal topotecan is followed. Is
Okay.
what I was told.
As per the international norms,
Okay.
it's given purely just for the vitreous seed. It's not for this. And we usually give for. Had this been okay, the patient had bilateral but activation in the one eye, right?
Yes, sir. Yes.
Okay. Why was not IAC even considered?
Which one, sir?
Intraarterial chemotherapy for this patient.
It was sir, bilateral retinoblastomas.
And one is already you have mentioned that
Mentioned that.
regressed, and also we have tandem therapy as well if you want to. In the present day scenarios, okay. Anyways.
Yes, sir.
Yeah. Fine.
Thank you.